Hello everyone, welcome to sqadia.com. I'm your educator, Dr. Lara Munir. In our series of lectures on hematology, we started off by talking about the different types of anemias. Then we classified those on the basis of their MCV and later on reclassified them on the basis of either the anemias of production or the anemias of destruction. In the anemias of destruction, we talked about the hemolytic anemias, and today we are going to talk about the anemias of production, which can also be termed under the umbrella of the bone marrow failure syndromes. They can either be normocytic normochromic or they can be some macrocytic anemias. So in these bone marrow failure syndromes, we are going to start off by talking about what are the major disorders which come under the umbrella of this term, and then we are going to talk about them in a stepwise manner. Starting off by discussing the pancytopenias. How do we define pancytopenias? What is the differential diagnosis of pancytopenias, and how do we differentiate the different types of pancytopenias based on the bone marrow picture? Then later on, we're going to move on towards our main topic of discussion of this lecture, which is the aplastic anemias. We're going to start off by defining the aplastic anemias, then later on moving towards the etiology. In a very good detailed flowchart, we are going to classify the various types, look for the different etiologies of the acquired aplastic anemias or the inherited types of aplastic anemias. Moving further, we are going to discuss the pathophysiology. In a very simplified diagram, we are going to see what goes wrong at the hematopoietic level that leads to aplastic anemias in these patients. Then, just as for any disease, we start off with the basics, with a good history. What are the important questions to ask? What are the basic things to look for in a good targeted history of the patient with aplastic anemias? Then, how do we supplement it with a good physical exam? What are the important things to look for? How do the various systems correlate in patients presenting with aplastic anemia, either secondary to a primary problem or as an idiopathic problem? Then later on, what are the important labs and what are we going to see in a peripheral blood film of the patients with an aplastic anemia, what is the bone marrow examination or the bone marrow smear going to look alike in patients with this disorder? And then we basically diagnose the patient looking at the whole complete picture. And after we have definitively diagnosed that patient with aplastic anemia, then we investigate to look for the underlying pathology or the underlying cause. If we are able to find underlying pathology, then we basically treat the primary disorder, and that's secondary aplastic anemia goes on its own. But if we are unable to find an underlying etiology, then we termed it as an idiopathic aplastic anemia. And then with the help of a nice flowchart, we are going to look at the various treatment options which we have, either in the supportive care or for the definitive management of the patient. The second important topic to discuss in this lecture is the pure red cell aplasia. Generally, it is a spectrum of disorder leading from the pure red cell aplasia to aplastic anemia. The signs and symptoms and the classification or the underlying problems are more or less the same, which lead to aplastic anemia. There are certain differentiating points. For example, when a fetus presents with RBC aplasia, and that is a different condition called a non-immune hydrops fetalis. Certain types of malignancies can present with RBC aplasia as well. With the help of these classification flowcharts, we are going to look into detail as what are the most important causes of this pure red cell aplasia. Then what are the other disorders from which we have to differentiate aplastic anemia? What are the differential diagnoses? And then in the final flowchart, with the help of, we are going to look at the clinical features of certain important types or certain important pathologies presenting with aplasia, and then their treatment modalities. What are the symptomatic treatment options? How do the treatment of the primary disorder lead to basically resolving of the symptoms of pure red cell aplasia? And then what are the various types of anti-cancer drugs which we have that can be used to treat these disorders? So to watch this complete lecture along with thousands of other medical lectures on any area of your interest, be it the basic medical sciences if you are an undergraduate or clinical sciences if you are a practicing physician, please log on to sqadia.com and start your free trial today.